Healthy Start program is important because you're able to go to the doctor without worrying about how you're going to pay for it. That's a very scary reality.
The important thing about Healthy Start in Connecticut is that it allows virtually every woman who becomes pregnant and needs to get care during her pregnancy to have that care available to her.
The prenatal care that you have to have during pregnancy is really important, so I think the Healthy Start program can really help in a lot of ways.
There are medical problems and conditions that can come up in pregnancy that you're really only going to discover if you're getting regular care by an appropriate healthcare provider, an obstetrician or gynecologist, or a clinic to allow you to make sure that you're doing all the things to make your baby as safe as possible.
The Healthy Start program helps families with application assistance for medical insurance.
We offer a referral service over
Our caseworkers help pregnant women apply for Husky health insurance. Then we can connect them with an OBGYN, a pediatrician, and any dental or behavioral health services that they may need.
It's all for pregnant women and children under 3, so as long as you still have a child that is under the age of 3, you can still continue to get Healthy Start services.
We have services all over the state. We cover the western region, the eastern region, north and south. We're in both cities as well as more rural communities. Anyone can contact InfoLine and get the phone numbers for their nearest Healthy Start site.
Most programs have bilingual staff throughout the state of Connecticut.
There's a lot of information that comes in the mail all the time, and it keeps you up to date with all of the kids' appointments that they should be having and with the physicals and all of that. I don't know about any other program that helps out so much.
Because my husband is self-employed, we were looking around trying to see what sort of insurance we can afford on our own, and it was completely out of reach for us.
Do you remember how much you weighed last time?
Husky eligibility is based on income. Many women believe, I don't have insurance, I don't have access to care. What's fabulous about Healthy Start is that we're able to screen women for their Husky eligibility, help them through the application process to get that coverage, and then provide ongoing support so they receive the services that the coverage offers them. We help women get on Husky so that they can get the care they need to have a healthy baby.
We have undocumented women, obviously, that are not eligible for the insurance, but they are eligible for the emergency medical. So I definitely see a huge range of clients with, different situations.
I was surprised to learn that my previous insurance coverage was not going to help me in any way for this pregnancy. When I walked in that door and she said, are you employed? What's your income? You're all set. It was just a huge weight lifted off my shoulders.
It's my first baby, so I have no experience. I don't know nothing about babies, so I'm learning. Because before I didn't know what kind of food to eat to help me, be healthy and then keep my weight on. But with the healthy program, so they tell me what to eat and what's good, what's not good for my body.
It's really a very comprehensive program. Some people enter the program and they may be looking for the insurance. Some already have insurance, but they need some support during the pregnancy.
Case management services can include anywhere from housing assistance, child care assistance, connecting them with their nearest local WIC office for nutritional education. We also coordinate care for parenting classes through our Nurturing Family Program network in Connecticut.
We know that the earlier a mom receives prenatal care in her pregnancy, the better the outcome, the healthier the baby is, the better chance she has at successful breastfeeding, and Healthy Start makes that happen.
It makes a lot of difference because when I hear from someone else, some people say, oh, it doesn't matter. You can either breastfeed your baby or just, And the program say it would be much better to breastfeed your baby for at least 9 months. How long, however you want to do it, for how long you want to do it. It makes me feel like I have 2 mothers or someone around helping me.
The resources we give people range from the basic needs that they have for their children. So it could be car seats, it could be maternity clothes, it could be diapers, it could be a dental appointment that someone hasn't had in several years.
Healthy Start has a really important role in raising awareness about oral health. That's their whole role, is to get mothers set up to have healthy infants and to get them all into the right services. So they are very important in educating the mothers about oral health, helping them find the right dentist in their community that they can go and see, and encouraging them to follow through on all the needed treatment. And they're also right there after the infant is born to help talk to the mothers about the right way to feed them, about when to brush their teeth, and when to make the child's first dental visit.
No one should ever hesitate, no matter what their circumstances, to give us a call. There is no price in asking, and chances are we're going to solve the problem in one way or another, and we don't give up.
You shouldn't be nervous about it. You should be free, feel free to walk in, and then, because the people, they friendly, they really nice to you.
You just want to feel security for your family, and I think that that's what the Healthy Start gives you, is security and comfort.
It's not just paying for the doctor's visits, it's the support, it's the care of the mother and the care of the child. It is a huge safety net for a pregnant mother of more than one child, and leads you into this other network of support for the entire family.
And we're there as long as families need us. Sometimes they come back 6 months later, sometimes it's 6 years later, and we're still there. And we're still there in our communities, and we have the reputation of really being able to strengthen families and support them as they need it.
I love doing what I do. I love seeing clients, helping them have the best pregnancy that they can have. I love hearing about their healthy babies once they are born.
If you're pregnant and don't know where to go, contact your local Healthy Start office.